Good morning, everyone, and welcome. My name is Sherelle Fulton. I am a mother, a community health advocate, and co-chair for Healthy Starts Community Action Network. Thank you for joining us for Healthy Starts' second annual legislative breakfast, hosted by Healthy Starts Community Action Network. This event was created to advocate for policy supporting Black mothers and babies. This year, our focus is on how we can build back better in relation to policy affecting Black mothers and babies in Allegheny County. We're thankful that you are joining us today to learn more about how you can advance the conversation to eradicate preventable maternal and infant death. Now, I turn it over to Healthy Starts CEO, Jada Sherelle.
Thank you, Sherelle. Good morning, everyone. Thank you for joining us this morning for our second annual legislative breakfast. I wanted to thank our Community Action Network for all of the hard work that it took to make this possible for a second year in a row. Our Healthy Start staff that supported all of the planning efforts and bringing everything together. And of course, you for coming here today. We have a wonderful lineup of speakers and folks who are giving their testimonials as part of our Healthy Start family. So thank you to our speakers as well. So excitedly, we have a keynote this morning, and I'm using my technology, which I don't normally do, and I don't use it for a reason. We have a special keynote this morning. Really excited to introduce Dr. Margaret Larkins-Pettigrew. She is an international healthcare strategist, maternal and child health, infant health expert, professor, and author. Dr. Margaret Larkins-Pettigrew is the Senior Vice President and Chief Clinical Diversity, Equity, and Inclusion Officer for Highmark and Allegheny Health Network. She is also a professor of Obstetrics and Gynecology and the author of Colors of My Heart, Embracing My Blackness Through History, Family, Fear, and Faith. So we are excited to have Dr. Larkins-Pettigrew, not only here with us this morning, but back in Pittsburgh, working to advance the cause of maternal and infant health. We're excited to continue partnering on these efforts and to kick off the exciting next hour and a half that we have for you. So without further ado, Dr. Larkins-Pettigrew.
Good morning. And if I can have my slides up, that'd be great. So I am so excited to be the keynote for such a wonderful organization that has jumped in with both feet to really become advocates for women and for children, but really to focus on what's been an issue for us for many, many years. We've not seen a change in the health and well-being of Black mothers for decades. So I'm going to tell you about Connie because I come to you today not only as a professor, but I also come to you as a mother of three young Black men who are successful, who that's, as if you're mothers, that's probably the most important job and the hardest job in the world, being a mother of Black boys and girls, but particularly Black boys in this country, but also come as a mother-in-law, a grandmother. And I know I don't look old enough to be a grandmother, but I am a grandmother. And I come to you as a woman who really is concerned about this space. I'm not only here this space as a woman of color, but Connie, who is my daughter-in-law, also gave me a call when she was having our second grandchild. And she was in the labor suite. She had delivered our grandchild, and she was bleeding. And she said that the nurse was telling me that I'm bleeding too much. And I said, well, what does that mean? And she said, well, she's telling me that the doctor needs to come see me, but the doctor's tied up. And I said, let me speak to the nurse. The nurse gets on the phone and she said, yes, she's been bleeding a lot. She gets up in the bathroom, she's bleeding, and I can't get the physician to come see her at this point. And so, of course, I said, who's the physician? I called the hospital, which is in Maryland, and I asked for the physician, and I give my name, and the physician gets on the phone and says, and I say, my daughter-in-law is just delivered. I've spoken to the nurse. The nurse says that she's really bleeding a lot, and she's really concerned. And they're just kind of waiting for you to come because the nurse believes that she needs to go back to the OR to have a DNC, to really have a procedure to make sure she's not bleeding and stop bleeding. And the physician said to me that I am the physician in charge here, and I will make that decision. And, you know, I didn't hesitate to say, absolutely. I am a physician also, and I know, based on what they're telling me, that she's bleeding too much. I expect that you're going to be seeing her very shortly, because if anything happens to her, of course, you're responsible for her. And she said, "Who is this again?" I said, "Well, my name is Dr. Larkins-Pettigrew, but I'm a mother-in-law, right?" And I thought about all the folks who couldn't advocate for their family members as well. When I called back, she was already in the operating room. But she could have died. Many of us have those experiences and can witness many of those experiences, not only just with ourselves or our moms, but really have those experiences that we really can make sure that mothers are not dying. The highest rate of death for Black mothers is ridiculous, especially in our own city, as well as our babies. And so what do we want to do about this? We want to be advocates, but that means all of us have to be advocates. And if you want to go ahead and pull up my slide, so are you going to drive for me now? I hope. Okay. So basically the objective of this morning is to think about the political determinants of health. I always want to start with the political determinants of health because I know, based on being in that space and being an advocate for women and for what happens to women, that those political determinants of health absolutely result in the social determinants of life and what happens to all folks, especially minoritized folks, but what happens to women especially, and how those social determinants can affect anything that happens to them on this pregnancy journey. I mentioned data justice only because I want us to keep in mind that the data, we have so much data to support that we should be in the space. We should be dedicated and really make sure that we're intentional about this space. And so if the data tells us that, but data justice means we use that data in a way that we make a difference in the lives of the people that we're trying to serve. If you go to the next slide, let me just talk a little bit about health equity. Margaret, if you don't know her, phenomenal speaker. She always talks about health equity and talks about how we all should have that opportunity. And so really her definition is about all people and how we all should be able to have the same opportunity for good optimal care no matter who we are, no matter where we come from. The next slide really just talks about how we get here in the first place and how these health disparities arise and why we need to think about it. Now keep in mind, it starts a lot with the issue of legislation and why we're here today to talk about how we need to be part of that process of being a legislator. We are all advocates. We are all living in this country where we can make a difference. So how do we get to health disparity in the first place? The first thing is that the differences in quality care within any healthcare system. We're talking about any large, small FQHCs. It is a matter of how people have access, how we're treated when we come into those systems as Black women. How those differences result in access to care. And we're going to talk a little bit about the Build Back Better program as well as the Omnibus program. This is where most of these issues where most of the fight is occurring. How do we get access to care? How do we prevent any of those chronic diseases and those long-term effects of being pregnant? And how do we think about curative services? Our issue is we can't talk about disparities unless we talk about what happens in our life as far as opportunity and what we're exposed to and the stressors that have resulted in where we are today. Think about those long-term stressors that women have received throughout their lifetimes. Waking up just being a woman in this country makes a significant difference. The long weathering, the stress that we have as Black women, especially in this country, and how that also contributes to our health care, contributes to how we handle our pregnancy state. If you go to the next slide, Kamara Jones also talks about what are the barriers. And many people talk about barriers as related to access to care. We have to move beyond that and think about how we got here in the first place. So we have to really talk about the issue that we live in a society that's built on structural racism, systemic discrimination, and we have a minoritized population, a population that didn't want to be in this space, and that we're here. And we have to deal with that. We have to understand that, acknowledge that, And that means all of us have to do that. This whole thing about the myth of a zero-sum game, if I give you something, I'm going to have to give up something. We have to get rid of that because we know in this country, one of the wealthiest countries in the world, there is enough for everyone, especially when it comes to adequate health care. This issue about limited future orientation, that means that we're stuck where we are. We don't want to see change. And that we can't move forward unless we understand that we have to have a different view for what the future looks like. Then we can't move from here. And we're talking from a legislative point of view and from everyone who's on this Zoom, that we have to think about how we are engaging in these myths that continue to happen. The myth of American exceptionalism, we know what that is. We know the fact that who's better, what communities are better. And we see that every single day as we live in our communities working very hard. And the whole issue of the white supremacist ideology. We're not talking about men and women with sheets over their head. We're talking about a mentality that has occurred from attitudes that started way back in the 1600s that have continued. The attitudes are now beliefs, and now they're behaviors. And those behaviors make sure that we are where we are now in this space of trying to change legislation in order for Black women to get the valuable health care they need. If you go to the next slide. So, looking at the past, the present, and the future, we have to think about all of the determinants that have affected health. I listed a number of these here for you. I'm not going to go through all of those, of course, because of time. And I think I have about 10 minutes left, so I'm going to really concentrate on those things I need to. And that's the issues of the Build Back Better plan, the Omnibus Act, the issues of doulas and what happens. In fact, we need to think about how we pay for doulas and community health workers is a very important part of who we are. Let's go to the next slide. Let's talk a little bit about the Build Back Better plan. We know that it passed in the House. It did not pass yet in the Senate, but we know what that is. And this is what I want to spend time with, just making sure everyone understands what the value of the Build Back Better plan is and how it will make a difference in the lives of so many women. And so when the press release came out, very specific things were said in that press release that I want to make sure you understand. And it is that this plan will extend postpartum care for 12 months. 12 months. It is focused on Black and Indigenous moms, birthing people who deserve to have safe, healthy pregnancies and birthing experiences. Included in the Build Back Better plan is the Omnibus Act of 2021, which covers so much as far as the things that we need to think about and that needs to be in this bill and as it passes, as it relates to what women need to be better, to get the best health they can, as it relates to healthcare. And so I just want to go through quickly what that means and what that would mean for Black women. And so there's, of course, millions of dollars that will have to go into the Build Back Better plan. And that's why there's so much fighting. But it covers not only all of those things I just talked about, but quickly. It will fund housing, nutrition, and environmental conditions. Do you know how many women, Black women, are still living in those places where there was redlining and where there are in those places where there's so much lead, our children are still being exposed to that in this city? I can show you a map of all the places that still have folks living there that are still redlined and come to us with multiple issues. We need to think about that, as well as thinking about what happens with the workforce. The Build Back Better plan will cover workforce that includes not only nurses and midwives, physicians, but also doulas. And also, when we think about doulas and the doula support that we need, these are the folks who usually live in our communities, who know the community, and who really can make sure that they are the allies for moms who are going through the journey of pregnancy journey and before that. And so this also would cover the maternal, mental, and behavioral health professionals as well. Another thing is the issue of maternal health. We can't forget about maternal health. The majority of deaths that happen to women, especially Black women, happen in the postpartum period. And that is a period that we need to focus on significantly. Doulas and community health workers are significant in that space. We need to make sure that their workforce is expanded and it is covered as well. Looking also at the climate change related to maternal and infant health. What happens in the professional schools? What are we doing as far as teaching our next leaders, our next healthcare leaders about cultural humility? Where are we at with that? This law will make sure that we have bias training among all our healthcare professionals, and that we have bias training throughout our training programs as well, so that when we have new physicians, new nurses, that they understand that we need to give care through a social justice lens. Another really big one, before I talk a little bit about where we need to go with the omnibus, is the issue that we have to make sure that our communities are involved. My last slide, which just said advocate, or the call to action, is all about advocacy. We must be all about advocacy. Every last one of us has a responsibility to understand that this is not just an effort. This is a movement. And we look back and think about all the movements that have occurred in this country and how they've been successful. This is an intentional movement that we all have to be a part of. Moms are dying at significant rates. Black mothers and birthing people in our race dying at significant numbers. We have data. It is time for us to move in a direction that we put pressure on our legislative leaders to make sure they're making a difference. The Medicaid gap that exists, that we can't be taken care of. To remember that if you were covered, you were not covered by the Affordable Care Act. And many of the states did not expand Medicare. You didn't have insurance before you got pregnant. You did have insurance in most places while you were pregnant. But after you delivered your baby, you were not pregnant. And that gap of care makes a significant impact on your life. Prior to getting pregnant, the chronic diseases that come into pregnancy that also contribute to poor outcomes, the post-care that we do not get because we did not have Medicaid expansion. This is also a major issue, a major challenge for us. You are an advocate. Look at yourself in the mirror every single day. Tell yourself, I am an advocate, but you're not an advocate without allies. Our white allies are all of our ethnic origin, all of our friends, our allies, and must be advocates as well. You have advocates. You need to be an advocate. With that, I'm going to end. Please know that these are very important legislative decisions that have to be made, and we have to be at the table, at the space where these will happen. With that, thank you so very much for having me today. It's been an honor to be your keynote speaker for your second annual legislative breakfast. And I'm going to turn it back over to the leaders of the conference. Thank you again for having me.
Thank you, Dr. Pettigrew, for that keynote address. You really captured the importance of how your work and others are impacted by legislative action. Healthy Start is dedicated to amplifying voices of our community, and it was important for us to invite community members to share their stories. Without further introduction, I present our first testimony, Ashley Buford, mother and Healthy Start community health advocate.
Hello, thank you for having me. I'm a 29-year-old single mother too, and both of my pregnancies were high risk, but thankfully for Medicaid, I had 2 safe and beautiful deliveries. About halfway through my first pregnancy, I found out my cervix was short, and I was at risk for miscarriage or preterm labor. This was a very scary situation for me, as I had no clue what I was expecting or what caused it. I was told I would have to be seen by maternal fetal medicine at McGee Women's Hospital. So after about a week or so on bed rest, I finally
Ashley.
the medication. So at this point, I would just about anything else. I didn't mind starting a new medicine, but this world to me was so unknown and scary. It took a few days for my insurance to approve the medicine, which I found out was over $600 for a month's supply. And I needed this medicine for the rest of my pregnancy, as it was very important and vital for me to keep from going into labor. At the time, I was not employed. I had no savings. My pregnancy was not planned, so I wholeheartedly depended on Medicaid, even for prescriptions. At the time, I didn't even know there was a possibility of paying out of pocket for these types of things. This was all new to me. I wasn't knowledgeable at all. I learned fast how important Medicaid would be to my family. And thank God it was approved by my insurance, and I was able to start taking the meds shortly after. The pregnancy went on full time with no more unexpected issues, and I remained on bed rest. My labor was smooth, my daughter was and still is very healthy, and I'm very thankful for that. My second pregnancy 8 years later was very similar, except I developed preeclampsia, which could have been fatal for me and my baby. I was also put on bed rest for this pregnancy, and I again had to get numerous tests done, which included fetal stress tests, as well as weekly lab taken. Besides one medical emergency 24 hours after giving birth and all this hemorrhaging, myself and baby are fine, and thanks to my very attentive medical team, they were able to treat the situation with no hiccups. Says I was grateful to have my two healthy children. I was also grateful to have Medicaid in both situations. I wouldn't have been able to afford the medications, the testings, or anything that came about throughout my high-risk pregnancies. So it's very important for other mothers like myself, single, unemployed, being a minority and part of the CHA cohort with healthy sources to survive, to go on and have healthy, successful pregnancies. Today, both of my children are healthy, as am I, and we still depend on Medicaid like so many others to hear how important Medicaid is in our household.
I just want to say thank you all, or thank you, Ashley, for that testimony. I would like to take a moment to introduce our moderator for this event, former school board director, current First Lady of Wilkinsburg, Marketing and Communications Development for Healthy Start. Her work with Healthy Start has been phenomenal. Ashley serves as Vice President for the Catapult Greater Pittsburgh Board, founding board member of Unite, and board director of Pittsburgh Urban Management Project. Now, Ashley Comans, our moderator for this event.
Thank you so much, Latavia, and good morning, everyone. I'm really excited to be here today and to also get started on this panel. We have a very esteemed panel of folks that we're going to ask some questions when we're talking about the legislative process and a lot of policy that goes into what we're discussing today when we talk about maternal and child health care. So just to briefly go through each of our panelists, we will have State Representative Summerly for the Pennsylvania 34th District. We will also have State Representative Morgan Cephas for the 192nd District, for Pennsylvania. Morgan Overton, who is the Policy and Community Engagement Associate for WHAM. Sharday Jones, who is an author, advocate, and the former mayor of Braddock. And Felicity Williams, who is Deputy Chief of Staff for the Mayor of Pittsburgh. And last and certainly not least, we have Marin Formley, who is the Executive Chair and founder of Voter Empowerment, Education, and Enrichment. So good morning and welcome to all of our panelists. Trying to look if I can see everyone. There we go. All right. So I'll get started with our first group of questions. We really want to discuss the Medicaid expansion. So the 2021 American Rescue Plan Act, it gave states the option to extend the Medicaid postpartum coverage to 12 months for up to 5 years, which some states plan to adopt, including Pennsylvania. Our coverage is set to begin April 1st of this year. So my first question is for Representative Morgan Cephas. And this question is, so what should families expect and how is it intended to improve maternal health? And what steps can we take to encourage this expansion to be a permanent coverage option for families covered through Medicaid?
Well, first and foremost, I just want to thank you for allowing me the opportunity to come out west to have this conversation about maternal mortality. You know that myself, as well as my colleague Summer Lee, and just so many advocates on the call today, we have been hammering home this issue, not just since it was passed during the Biden administration, but you all have been at the forefront of this conversation for at least over a decade. So, I thank you for your continued advocacy for that. And I definitely say give yourselves a pat on the back for this progress, because this is progress for birthing people, not just across the Commonwealth of Pennsylvania, but across our country. So, just as you know, when it came to Medicaid supporting birthing people, the coverage only lasted up to 60 days. And, we all know individuals that have been pregnant, that have given birth. And we know, immediately following your birth, having to navigate a healthcare system if you are losing your coverage is extremely difficult. And, all of the services that you receive during the perinatal period, during the actual delivery, and during those 60 days, those are critical services that we need in order to keep not just our birthing people healthy, but also their babies. So as we're dealing with a maternal mortality crisis, you all know that we are dealing with an infant mortality crisis. And, to ensure that, the individual that just had recently given birth is taken care of, that'll inevitably translate into, a healthier baby. So some of the things that, we think about when you're talking about services, and when we look at the data, we understand that nationwide, and this is similar here in the Commonwealth of Pennsylvania, that roughly around 51% of the maternal mortality deaths that occur happen during the postpartum period. So that's why you see a significant focus on ensuring that those services are still, the continuity of services are still prevalent. And, as much as we've been talking about this issue, we've seen a 21% increase over between 2013 and 2018 here in the Commonwealth of Pennsylvania. But then, if you add on COVID-19 and, not having Medicaid extension, we literally saw a 14% increase during the COVID-19 period. That was an article that had just come out in the New York Times. So, we are far from our addressing this issue and reversing our trends. But extension of Medicaid is a step in the right direction. But know that it is not the only, it's not the kill shot that will really address this issue. There's so many challenges within, our social systems. We are beginning to elevate the conversation around, the racism that exists in so many different institutions that birthing people interact with, that also contribute to their maternal mortality rates. So again, as much as we've been talking about extending Medicaid, we have to know that that is not the end of this story. But, what families should expect when we're talking about extending Medicaid, we're talking about the extension of medical coverage for, home visiting services, for lactation support. I mean, one of the issues that we're seeing here in the Commonwealth of Pennsylvania is that we have a substance use disorder challenge. So 23% of the deaths were caused by accidental poisoning, which is also known as drug overdose. So ensuring that drug treatment is still, an option for birthing people is going to be critical, as well as mental health services. We all know that postpartum depression is, a real clinical challenge that, we have yet to face and yet to challenge. So having the ability to expand Medicaid will be able to continue those services. And that's the critical part. Because again, when we're talking about that a majority of our deaths happen during this time period, we know that, preeclampsia, blood clots, heart problems, again, accidental poisoning, don't necessarily surface during the time of the pregnancy, during delivery, but might come up and be elevated weeks and months, after the individual gives birth. So again, it's really the continuity of services that individuals will receive as a result of this extension. And, just one of the ways to continue to ensure, we only have this for 5 years. And if my colleagues on the other side, they do not like the idea of spending more money on helping people with Medicaid. And I'm sure Representative Lee will touch on that. But with us only having 5 years, it's important to, really track the data. Data is something that, nobody can hide behind or tell a different narrative about numbers. The data is the data. And, as long as we are tracking the progress, the increased, the potential reversing of trends that could potentially happen, our ability as a Commonwealth to save money because people are getting access to care, and ensuring that we tell that story, that it's not just an urban issue. In urban areas, we have more access to public transit, to healthcare facilities, to providers, but we also have to tell that story when it comes to rural areas as well as suburban areas, because they too are dealing with this challenge. So I think that's going to be critical, that understanding that this is not the end. We still have so much more work to do. And I'm sure we'll talk about that later in our conversation, but Medicaid extension is just the beginning.
Thank you so much, Representative Cephas. I think that's really important. And as you discuss that, it makes me just think of organizations like Healthy Start and how we really have that opportunity to support that data and the storytelling that comes from when we make these changes. So thank you so much for that. This next question is for Representative Lee. So I'm looking forward to this answer. Can you share with us just the barriers that do exist when we talk about extending Medicaid coverage outside of the American Rescue Plan Act? And can you talk about the policy process in general and the barriers that you all as legislators do face in Harrisburg, understanding the power dynamics between the parties?
Yeah. Good morning. Hey, Ashley. Always love being on panels with you. And just echoing my colleagues' sentiments about just the incredible work that you all have been doing and that you've been leading on, and recognizing how, and this goes part into the answer, right? How so much of the work that we as legislators do around some of these issues is always bolstered and really founded in the work that comes from community, the work that comes from these community organizations and advocates, organizers. It lays the groundwork. And what we've experienced in our governing bodies, right, particularly Harrisburg, where we are in just a tremendous, gridlock, is frustrating and it's nasty, right? And it's discouraging. But we would not even be close to where we are now without the work that's being laid here, right, in these events, the work that's coming in from folks who have been presenting. So thanks for having me again. I was with you all last year. And, that is a big question. It is really a question about our priorities as a country, our priorities as governing bodies. When we're thinking about who Medicaid helps, right, who Medicaid expansion helps, I think we get straight to the point. And it overwhelmingly is helping folks who are living in poverty, who are more likely to be Black and Brown women, children in this country, right, as we are kind of dealing with a child poverty issue. And then we think about who are the folks who are making the decisions, right? Our government is basically, and not basically, but for so long, right, it's been pretty dominated by men, right? By white men and by white folks, and by a class. There are class divisions even within our government. And those class divisions, those gender divisions, those racial divisions, they play out in every single policy, that we have. And when we think about the barriers to Medicaid, when we think in Medicaid expansion, that is an unwillingness to fund critical infrastructure. And when I think of infrastructure, it's not just physical, it's social, but funding critical infrastructure for folks who need it most, for folks who are in poverty, for Black and brown folks. And that is a policy choice, right? That is a commitment. It is a consistent commitment. There's often times where people think and they say, look, well, Medicaid is expensive. It's expensive to fund folks in poverty. And then the sticker shock is one of the things that is always cited for why we can't have Medicare for all. It was the thing that was cited for why we couldn't pass Build Back Better. And we have to look at the people who are fighting back against that. And of course, those are right-wing folks, those are Republicans. But what we saw just recently with Build Back Better was that it was being stalled also by conservative Democrats. And Build Back Better had more provisions, right? It wanted to, or was seeking to, in its first plans, to extend Medicaid for comprehensive vision, dental, mental health care. And we know that those are all interconnected. The other thing that I would say is that even to the cost of Medicaid and Medicare expansion, right, we have to think about the cost on the back end. I heard earlier in the keynote, talks about the social determinants of health. Well, those are expensive as well. And what ends up happening in America, right, we don't invest on the front end. We don't invest in those things that would help prevent illness, that would prevent some of these pre-existing conditions, which then add on later. So it actually costs more on the back end. Now, to say, what are those barriers, right? I think it's very clear, right? There are legislators who hate poor people. They hate poor people, right? There is a war on poor people. And that really drives so much of the hesitation, so much of the fight that we're having to have. In Harrisburg, we have a hyper-partisan chamber. Both chambers are hyper-partisan. We have Republican legislators who will readily say publicly that they will not run Democratic bills, and we have good ones, right? Rep. Cephas has been leading the way on the maternal mortality rate with common sense bills that would get to the heart of it. They are consistently introduced, and we have broad support for them. But because the rules allow the Republicans to completely run the table, right? What bills are being referred to committee, when they're referred to committee, and then the committee chair gets to then determine when we vote on bills, right? They can just continue to keep our things and put it away and never bring it forth. And that's what's been happening with so much of our bills, so much of our advocacy work. And here in the middle of a pandemic, right? While we've been fighting for so many of the things that are not just kind of the direct things that Rep. Cephas just mentioned, right? Those things that would help birthing people, that would help children, that would really tackle that maternal and infant mortality rate, but also some of those pre-existing things, paid family and sick leave, childcare, so many of these other, education equity, transportation, housing justice. We have bills for those. And we have consistently proposed legislative solutions for them. And we've consistently fought for them in appropriations and during our budget period, which we are doing right now. But Republicans refuse to even kind of negotiate with us. There is no negotiation. So it's important that when we think about our election cycles, when we think about those folks who we are lifting up in our communities to represent us, who is standing in the way of life-saving policies and life-saving appropriations. And I think that's what we're dealing with in Harrisburg, and that's exactly what we're dealing with in DC also.
Thank you so much, Representative Lee and Representative Cephas. We need fighters, and you two are fighting for us. And I think it's really important, those points that you bring up as to our representation and ensuring that we're supporting you, because if we don't have your voice, then we're really lost when we talk about legislation happening up in Harrisburg. So you kind of talked into the Build Back Better Act. So I'm going to transition. This question is for Morgan Overton. So the Build Back Better Act builds upon the current Medicaid expansion by requiring all states to extend Medicaid postpartum coverage to 12 months permanently. That bill also builds up the Momnibus legislation, which was our focus last year with our breakfast. And the bill has gone through several revisions and then ultimately died on the Senate floor. And lawmakers are hoping to revive the bill. So Morgan, can you talk about what is the benefit of looping comprehensive policy into a larger act?
Yes, thank you, Ashley. And Honestly, my short answer is ditto to everything Rep. Lee and Rep. Cephas said. The fact that Build Back Better is in limbo and basically a dream now is a disgrace, because for all of the reasons that Representative Lee said. We are seeing the impacts in real time of what happens when we don't have a robust foundation of social infrastructure in our country. And in case you missed it, we are still reckoning with the pandemic, and we were already confronted with disparities as our baseline before the pandemic. And as we already know, it's only amplified disparities across the board, including economic disparities. And as we know, vulnerable communities are hit the hardest, like working families, especially Black women. So elements of the Momnibus package that were included in Build Back Better addresses all of those intersecting issues, right? The environment, housing, income. And we tend to not think of these things as public health crises, but they are. And I just wholeheartedly believe that policy has the power of prevention. I don't know if I'm echoing, but I wholeheartedly believe that policy has the power of prevention, of proactiveness, instead of the reactiveness that we're so accustomed to in our country. And so, for example, when you invest in basic human rights like childcare, over 1 million women due to the pandemic left the workforce. And much of that speaks to the lack of a childcare infrastructure and access. And that's an intersecting issue that impacts labor, income, and it's a gender equity issue. And then when you think about children, the child tax credit, right? That has lifted over 3.7 million children out of poverty. And the fact that that wasn't renewed, we're just going back, like the bar is so low. And the fact that we're talking about this in the United States of America is absolutely a disgrace. And so when you include comprehensive policy, this is for not only the benefit of us, our public health outcomes, but this is for the next generation and so on and so forth. So we're setting a precedent for people to be able to live with self-determination and with dignity. So that's my short answer, but snaps to everything that Rep. Lee and Rep. Cephas already stated.
Yes, agree, Morgan. Everything is so tied together, and it's really important that we recognize that. So this next question I'm going to switch to for Marin. So can you talk a little bit about what you believe constituents can do to ensure that changes are made to policies and procedures to ensure that the legislation put forth does benefit us?
Thank you so much, Ashley. And good morning and kudos to everyone who's on the panel and to the keynote speaker and for everyone who joined us today. It is so important that not only do we show up to vote, but that we stay engaged with our elected officials. Honestly, it's a blessing to have representatives like, Rep. Lee and Rep. Cephas and others who are focused and who believe in how important it is to make Black maternal health a priority. But we know that there are others who it's not anywhere on their agenda. But we, the people, have the ability to do that. So as constituents, as engaged citizens, we have the power to hold our electeds accountable. And sometimes it takes phone calls, sometimes it takes emails, sometimes it takes a group of us calling and emailing, and sometimes you got to show up in person. But people power is everything, and it doesn't just stop on election day. But obviously voting is super important, and we need more people to do that as well. But it's a continual process. Civic engagement has to keep going so that our voice is not left out of the conversation.
Thank you, Marin. The power to people, greater than the people in power. We believe that. So this next one, I want to get into some housing and social determinants of health. This question is for Sade. So can you talk about, in your experiences, how should social determinants of health be looked at and prioritized in legislation to support our communities?
Actually, I think the biggest issue is how should be looked at from a human perspective and not a governmental process. In procedures point of view, too often we put too many steps in place, and that becomes a barrier to seeking a lot of the human services that we need. And we know this from just even if when I wasn't an elected
Hey,
official.
Sade, I'm sorry. I think we're having, everyone, yeah, we can't hear you. Is your audio turned all the way up?
Oh, no, it's not. That is the issue. Can you hear me now?
It's still kind of far.
Is it better?
No. Are you muted?
No, I'm not muted.
I didn't think so.
I'll just try directly from my phone. Can you hear me now?
Yeah, it's just, you sound so far away.
Can you hear me better?
There you go. Yes.
Okay. So sorry about that.
Okay.
All right. So I increased my microphone. Okay. So health should be looked at from a human perspective and not from a governmental processes and procedures perspective point of view. Too often we're putting too many steps in place and process that become barriers to seeking out these human services that we need in these communities. And whether you are an elected official or you're just a resident, we see these issues every day, and it's a deterrent, and it's created, especially in the Black community, is creating these barriers.
Thank you. Yes, there's so many blocks people put up instead of just getting straight to the point. So my next question, this is for Felicity. What are some policies that you believe elected officials can introduce or promote to impact social determinants of health? And additionally, can you expand on some policy priorities in the mayor's office?
Absolutely. Well, good morning. Thank you, everybody. I'm so happy to be here with all of these amazing women, especially these amazing Black women that are working in this field or legislators. Each day, the mayor and his team get up and think about what we can do to make Pittsburgh a welcoming, thriving, and safe city. What this means is that when we are presented with issues, we dig deeper into what are the root causes of that issue. And what we all know, and we've heard people talk about already today, is that a lot of the issues we face stem from intersecting and overlapping disparities, such as housing insecurity, access to affordable food, bringing in jobs that pay family-sustaining wages. And all of these items we know have a lasting impact on the lives and well-being of everyone in our city. And so each issue is different, and we look at how we introduce or promote policies that impact social determinants of health. But rather, what I'm articulating here is a process for how we go about doing that. And so reviewing policy through an equity lens that includes racial justice, economic justice, LGBTQIA justice, disability justice, and more. And really, as I said, targeting what are the root causes of a lot of the issues rather than just looking at that particular issue in isolation. Because again, the issues don't occur in isolation. We don't see the disparities. We don't see the lack of advancement in, we don't see the impacts in social determinants of health because they are siloed issues, because they are intersecting. And so that's how we have to approach these sorts of things. And then secondarily, second part of your question, you asked expanding on the policy priorities in the mayor's office. So I get this question a lot, and I really love it because I believe that it gives us an opportunity to highlight really a different style of governance. So one thing I want to say about our administration is that we've moved forward with our transition in a very different way. So we were intentional about taking the time to put together a team of experts, community activists, and residents across the city to create policy plans that impact everything, again, from public health and safety to infrastructure to housing and development. We didn't come into office thinking that we had all the answers. You know, we have some ideas, we have priority areas, of course, that the mayor has articulated, such as affordable housing, infrastructure, public safety, meaning both police reform and addressing the gun violence pandemic that some of our communities are facing, economic prosperity for all, meaning both workforce development and small businesses, education through a better partnership with PPS, and more. But again, the approach here, the process is what I really want to highlight as a different style of governance, because we believe strongly in the idea of co-governance. And that's how we plan to do the work to transform Pittsburgh into a city that benefits all of us.
Thank you so much, Felicity, and for the mayor's office and all the work that is happening there. It's been quite a few months for the administration, so I appreciate that. Going to transfer over with more Medicaid coverage and doula services. We know that doulas and folks, when they're going into birth, their babies are so impactful. So oftentimes doula services are inaccessible for moms and birthing people due to it not being able to afford the service. So what can organizations like Healthy Start and foundations like the Jewish Healthcare Foundation do to increase advocacy efforts to share and inform the importance of this need? And I'm sorry, this question was for Morgan. So if you need me to repeat it, let me know. But yes, that's for you.
Thank you, Ashley. Morgan Overton. I know there's a couple of Morgans on this. But it's so important to continue lifting up the power of doulas and have them be their own advocates. And I am so proud to, through my work, I have met an entire statewide group of doulas who last year have organized to gain consensus on reimbursement policies and certification and just the various standards of expanding access to doula care and honoring the doula profession at the very heart of it all. And now that work has transformed into the Pennsylvania Doula Commission. So I really want to lift up the 4 women who are at the forefront of leading this work, Jaria, Alita, Lauren, and Teresa. And they're continuing this advocacy. And, when you put the work into the hands of those on the front lines, it's crucial, especially doulas, because as Dr. Larkins-Pettigrew stated earlier, these are the ones who have built trust with the community. They're the ones who are committed to an equity lens. And they're literally the ones making the world go round. And it is vital for philanthropic institutions and nonprofits to recognize that power and continue to work in an intentional, transparent, and sustainable partnership with their lead.
Thanks so much, Morgan. And I thought about that. I'm trying to keep Rep. Cephas and Morgan so that we can not be confused. As an Ashley, I completely understand. So for Representative Cephas, for this question, there's a lot of movement happening on the ground to push for Medicaid coverage for doula services. And while it's a huge win for low-income families, there are some concerns about accreditation and equitable reimbursement for doulas. So when it comes to the Medicaid coverage for doulas, how can legislators make sure the policy is equitable and for the doulas who would be impacted by this?
Now, I appreciate that question, and I appreciate Morgan, the other Morgan, for her answer and just elevating the Pennsylvania Doula Commission. I have not been particularly in this space for that long. So in my role as a legislator, I heavily rely on organizations like Healthy Start and like the Pennsylvania Doula Commission to, guide the policy work that, I do. I made the critical mistake of assuming just looking at other states as best practices and assuming that is what, we needed here in the Commonwealth of Pennsylvania. But I was quickly, my coattails were quickly pulled to, really tap into those that are on the front line. And, that's not just important, but also ensuring that Black and brown people are at the table driving these conversations, because oftentimes in so many different spaces, so many different policy conversations, Black and brown communities, because of all the social determinants of health, because of racism, because of all the challenges it takes for us to even be able to get to the table, we're oftentimes left out of the conversation. And the policies that are pushed down on our communities don't have the impact that, we know is needed. So what's critical for legislators as it relates to doulas is to not just, again, listen to them, but every time we are having a conversation from a policy perspective to ensure that they are a part of the conversation. So not just the Pennsylvania Doula Commission, but when we're talking about the Maternal Mortality Review Committee, when I first, there was a Times article about the lack of diversity, the lack of the entire perinatal workforce not being represented on those review committees. communities, which, leaves out a significant gap and a significant lived experience that is needed when we're looking at, just for example, in the Commonwealth of Pennsylvania, where Black birthing people were 14% of the births, but 23% of the deaths. Because of those type of startling statistics, it's critical to have that diversity at the table. So I think, what is critical for us as we move forward is when we're talking about equitable reimbursement, not looking again at other states as best practices, but asking the practitioners, what does that look like? I mean, again, I learned quickly that when you add licenses and certification processes, it potentially creates a barrier for some communities to provide that service. So being intentional about, making it as less cumbersome as possible to, again, bring more people at the table to address this issue. But when we're also talking about equitable reimbursement for what? I mean, I know prior to this conversation, you had the managed care organizations responsible for dictating what doula care services individuals needed in order to remain healthy. But we heard quickly that it takes more than 3 visits. It takes more than several conversations to ensure someone gets the best use out of, doula care. So, really listening to the practitioners and the clients and the patients around structuring a system that doesn't create limitations already going in. So not limiting, again, visits, or not limiting the types of services that can be provided. I also learned that you have doula services during the pregnancy, at delivery, postpartum. So ensuring that, all of those opportunities are a part of the conversation. And I think, the last thing that, I'll press upon, again, as we continue to move down this road of ensuring that Medicaid is reimbursing doulas directly, for direct services, we also want to make sure that private insurers are also covering this type of care. I had a younger sister that I literally had to, as soon as I realized the difference between a midwife and what a doula was, I just immediately thought my younger sister should get a doula, and she was able to do it. She does work in private industry, and unfortunately her insurance did not cover it. So she really had to come out of pocket, but, luckily she was able to afford it. But that's not, the reality for so many individuals across the Commonwealth and, across our country. And when Representative Lee talks about creating policies to address the needs of poor people, that is, that's going to be critical as we move down this pathway of, creating equitable reimbursements for doulas, both in the Medicaid space, but also in private insurance.
Thank you so much. So we're getting to our last few questions, and I really want to get through these last 3 because these are probably my favorite questions. We're at the legislative breakfast, so we're talking about the legislative process. This first question is for Marin. So to many, the legislative process, it seems confusing and tedious. So what advice do you have for constituents to not only stay informed, but also get involved using their voices to push for more action?
It is so confusing, Ashley, like so confusing. Veeam has existed for the past 5 years, and I'm still nowhere near an expert. Every single election season, something is new, something has changed, or there's a brand new thing to do. So what I would suggest, everybody who's on today is make sure that you find a source of information and continually call and double check on those things. Here in Allegheny County, there is a full staff of office who can answer questions. I called them the other day just to confirm who was going to be on the ballot for the special election, just to make sure, because I did not necessarily trust all of the information that I was hearing. And it's just so confusing. We have the special election on April 5th. We have our regular primary election on May 17th. And knowing how those things intersect, how people got on that ballot, all of that, it's just a continual confusion. However, organizations like Veeam, Take Action Mon Valley, Weston Power, a lot of other organizations in this area work really, really hard to make sure that we are trying to get the information as much as possible. So what we need to do as constituents is make sure that we are plugging in to get that, paying attention to the things that are sent to us in the mail. even though we know mail is overwhelming, there's bills, all this stuff we don't want to look at, but also in the mail is your mail-in ballot application. There could be candidate information in there. There's emails coming, there's social media, there's still some TV stuff, there's some in-person candidate forums coming up. So, the best thing that we can do is try to plug into the information so that you know what's happening. And if you aren't sure what's happening, reach out and call somebody. Reach out and call VEEM, call Allegheny County Elections, call your elected officials' offices. They always do have people who can kind of help steer you in the right direction as well. And I think that just generally plays into our continued civic engagement, creating those conversations. It shouldn't be someone you just call when there are problems. You should be able to call your electeds to check in and see what's happening. Because also, if you don't stay plugged in, sometimes you miss some of the benefits that are out there for things that they're doing for constituents as well. So stay plugged in, stay connected.
Thank you so much. And just for that personal experience for yourself, because everyone is always learning something new. And I think sometimes people can be intimidated because they feel like they should know something. And that's not the case. We are all always learning. So this next question, this is for Sade and Felicity. Felicity, if you want to go first, then Sade, no pressure, but simply just talk about the importance of voting and the idea of increasing the diversity and representation at all levels of government. Because whether we're talking school board or we're talking federal politics, every single level is so important.
Absolutely. So again, I also love this question. Voting is important. Absolutely. And so often we hear this dichotomy of either or, but I believe it is a both and. Because, like I said, voting is important, but it's just the start. It is a critical tool that we can use to put people in place who are dedicated to improving the lives of the people we serve. However, but, we can say a big but, our civic duty, our civic engagement does not end there. We need to work together on the continuance of governance in order to make lasting change to the deep systemic issues facing our communities. And that means getting involved in local government the other roughly 363 days of the year that we aren't in primaries or general elections. For example, learn about what commissions you might be able to serve on. Join neighborhood groups, organizations, and community meetings. Talk to your city and state reps about issues that matter to you most. And this last one I'm going to highlight is one I do not hear a lot. Apply for jobs at the different levels of our government. So I'm talking to you guys today from the mayor's office, from the city. The city of Pittsburgh currently has 74 job postings open right now. So we need you to join our team. This is a way that you can get involved in the governance of your city. We need, thank you, Jada, I see you in the chat. Yes, we need to be in all the spaces. And so frequently this one about, taking jobs in the city is often forgotten as well. And so I'm actually just gonna do a pitch here to shout out the link where you can go find those opportunities, because I have this captive audience. You can go to https://www.governmentjobs.com/careers/Pittsburgh. And I'm going to drop that in the chat as soon as I'm finished here. But again, I want to highlight that we cannot solve these problems alone. It is going to take all of us. Let me also say lastly that it is an honor to serve in what is likely the most diverse mayoral administration in Pittsburgh history. We certainly know that this is the first Black mayor for the city of Pittsburgh, and it's truly an administration that reflects the representation of the city that we live in. And I want to say that we're not just diverse for the sake of diversity. Everyone in the administration is an expert in their field who brings a wealth of professional experience to the job, but also lived experience, because that is just as important. Looking at myself personally, I know what it is like to be a Black woman in a city that is one of the worst in the country for Black women. And that helps inform our team on what we can do better to uplift and change systems that keep all of us from thriving. Oh, and just rounding out again, I want to say, we need you to join us to get involved. Thank you.
Thank you so much, Felicity. Sade, did you have something?
Yes, bug your elected officials. It is very important. It is your job to bug them, hold them accountable. Go to council meetings to know what's going on in your community. And one person may not make a big difference, but the power of many is undeniable when it comes to voting. And it is how you show up for yourself and others. Not only the big elections, but show up at the small elections, because they may be small to you, but they are the things that affect your day-to-day life, down to how much you pay for your trash fees and whatnot. The small elections matter, and holding your elected officials and yourself accountable is very important. And the importance of diversity in government is having other perspectives in the room, not just for equal, but equitable representation.
Thank you so much. This has been the best panel. I do want to wrap it up with this last question, because I think this is really important for all of us as we approach the upcoming election. So this is for Representative Lee. After the 2020 census across the country, communities are going through a redistricting process. And so that means different people that folks are going to be voting for in some cases. So can you talk about issues of gerrymandering and how, when we have these maps and they're changing, how that is impacting our communities? So yeah.
Yeah, one of my favorite and least favorite questions simultaneously. So welcome to a redistricting year. As folks may know, as part of this just incredibly confusing web of electoral kind of issues and political comings and goings, gerrymandering and redistricting are go hand in hand, and they happen every 10 years. So when we do a census year, we are also redrawing maps, because we got to remember our state representatives, our city council folks, our congressional folks, those are all representatives. It's not executive, which means that they are sent to represent a population of folks. So every 10 years after the census, we redraw maps so that the information, the data that's come in is now reflected in the maps that are drawn, the lines, the districts, and the folks who represent them. So here we are. This was a very painful year. I mean, redistricting is painful in general, but this was a particularly painful kind of redistricting process, because we had to do it during a pandemic, and we had to do it during Trump's, sorry if anyone here is a fan, but we had to do it during Trump's years too. So the two of those things going at the same time delayed it. So we actually just got our final maps 2 days ago. We were supposed to have had those maps a year ago. So that just shows how slow the process has been, and how strange it's been. And that's been disenfranchising, right? Because as new people are looking to run for office, those folks didn't know what districts they were going to live in, which means that they had a difficult time mounting campaigns. So when we talk about the redistricting, our congressional one, I have the benefit of being in both right now. So the congressional districts, for instance, or a map of least change, right? 87% of the people in the Commonwealth are going to be in the same district that they were in. But what we know is that gerrymandering isn't just Democrat versus Republican. There was a lot of conversation and debate about whether or not the city of Pittsburgh should be split. And the argument that I had, and that I was very vocal about, was that when we split urban centers, those are more likely to be Black and brown folks, they're more likely to be liberal progressive folks. And it's consistently asking the most vulnerable populations to sacrifice their own representative power so that we can then anchor and help other districts that will never represent us. And it's precisely what we saw, where we saw Wilkinsburg, for instance, being split off from the city of Pittsburgh, and are now going to be in a district that will always be a toss-up and will likely have a Republican representing them for most of the next decade. But what that also means is when you split up urban center populations, you're cutting in half the Black vote, right? You're cutting in half the brown vote. And as folks who must vote in blocks, what it does is it dilutes our opportunity to control and have more influence over these elections, right? So as we're trying to figure out who is the person who we want to represent us, when we are split between multiple districts, for instance, in Nashville, they took an historically Black district and they split it in three parts. They split Nashville, where they had a Black woman running for office, and now there are 3 Republican districts instead of 1 blue district. That kills our opportunity to have a reflective democracy, as we are looking to ensure that Black women aren't just touted as the base championed for coming in every election cycle and ushering in a victory for Democrats, we need to see a corresponding support for our candidacies. Well, redistricting and gerrymandering is often a barrier to that. As we're talking about these critical issues today, right? The Black maternal mortality rate, infrastructure, and particularly divested communities, blight, housing, transportation, education, environmental racism, how all of those things are interconnected. We know that when folks don't have lived and professional experience, as Felicity mentioned, both, they go hand in hand. But as we have fewer folks who have those lived experiences, we see less of an urgency to address the issues and prioritize the issues the way that we see and that we know is most important for us. So that's how important redistricting is. And I want to end on this. We found there was a report that just came out a couple of weeks ago that saw that 19 million Americans were not captured in our census. 19 million Americans, disproportionately Black and Brown. Now we know that there are barriers, so many barriers to folks filling out the census. There's fear mongering, there's propaganda that comes down that says, for instance, if you're or an immigrant, that if you fill out the census, you may be deported. That's why these things are interconnected, addressing our deportation crisis, addressing our immigration, lack of immigration reform now directly correlates to whether or not immigrant populations and refugee populations are being represented. If black folks are not signing up and filling out the census, we'll have a situation where we're losing representatives. In Pittsburgh, we went from having 2 majority Black districts to, albeit 3 minority opportunity districts, but we now only have 1 majority Black district. And some of that is population change, absolutely. It's the fact that we have lack of equity. It's the fact that we have a lot of gentrification that pushed Black folks out of the city. But some of it is also that we weren't captured in the census. So as we lose representatives, that's a consequence of that. So that's why taking the census is so important, spreading information about that is, but also keeping track of what your government, your Democrats too, and your Republicans, what your Democrats are proposing when it comes time to draw new maps. Because oftentimes Black folks are used as sacrificial lambs to help other districts remain blue and at the expense of us having our own representative.
Thank you so much, Representative Lee. I told y'all we needed that question in there. So that wraps up this panel. Rep Lee, Rep Cephas, Morgan, Sade, Felicity, Marin. This was an amazing panel. I know that everyone watching has learned something. And I personally have chills over here just from your responses today. So I'm super I'm thankful for your leadership and your work. Please do not stop. We are here to support you all. And without further ado, we're going to pass this off to Latavia so we can get to our next part of the program.
Yes, I just want to give another thanks to our representatives and the knowledge that they bestowed upon us. I learned a lot in that short bit of time, and I appreciate that. Next, we're going to go to our second testimony. Jessica Coles, community health advocate and mother, is going to share her story and the effects that this may
have. Good morning, and thank you very much for having me. My name is Jessica Coles. I am a community health advocate as well as a Medicaid recipient. I am the mother of 4. So I have 3 lived experiences with the Medicaid postpartum. My first pregnancy in 2008 was about all the prenatal bliss that one can wish for in their first pregnancy. And again, being on Medicaid at that time, I was introduced to the community-based doula program, which was sponsored by Medicaid via UPMC. Wonderful program. Gives you, especially at a young age, I was about 19, 20 when I had my first daughter, great information, education on planning that I don't think many young parents think of. Fast forward 7, 8 years to my second pregnancy. I was pregnant with twins. Not a very good time for me mentally. About halfway through the pregnancy, I started noticing that I was struggling with mental health issues. Not so detrimental or drastic, but I could just see that I was not myself. And it's overwhelming to give birth each time it happens, I should say. But to go from 1 child to 3 in less than 5 minutes and that realization to kick in, it took its toll. I can say not even shortly after I had my twins, I was pregnant again and hadn't sought any help. I knew the resources, or I shouldn't say I knew the resources were there. I was advised to seek help prior to the pregnancy, but hadn't sought them up until well after I had my last daughter. But I say that to say Medicaid is crucial in that year after pregnancy or after delivery. Single mothers, even partnered mothers, you know what I mean, birthing people, we find ourselves in these positions and we're making more room for it now than it was then or than there has been in a while, where we're rushing back to work and we're not taking the opportunity to get ourselves mentally ready for that. Because again, you can spend 6 weeks, 12 weeks home with your baby, but you know you're not right. You know you're providing the right care, but you know your care for yourself isn't there. So again, I go back into saying it's so crucial because although it didn't go that way for me, my children, you know, we've made it. They're 13, my 6-year-old twins. My youngest just turned 4. We've gotten to a better place, but it could have went left for me as it has for so many other people. Not even just in our city. I can speak to at least 2 in our city, you know what I mean? And I don't want to bring anyone to a place of deep thought, but it makes you think when that young lady, you know, jumped off the bridge, there was help she could have received that maybe she didn't know she had access to. And we need to not only provide this access, but we need to ensure that we're aware of it, that our mothers are aware of it, our birthing people are aware of it. Because now that, again, birthing is it's evolving, we're going to see more people going through these issues, more people not seeking the proper care or not receiving the care because they can't afford it. And it has to, whether starting with Black and brown people, birthing people, we're speaking on that because it's so disproportionately available to us, but we're going to see it evolve into other realms and starting to affect other people. And unfortunately, I hope not. I hope we get to this before then, but I feel like that might be when this real change is going to come, and I hope not, because there are going to be a lot of families, mothers, children, who are deeply affected by not receiving the proper mental health care postpartum. Again, today we're good. I'm doing better, you know, but we definitely need to provide or find a way to create this access and keep it going for people who are in this need, in this space. It will never get better until we do. Thank you.
Oops, I'm muted. Thank you so much, Jessica, for that testimony. It is so important when we can have these vulnerable conversations so people understand these different perspectives. So super appreciative of that, that testimony. Just very powerful. So we're gonna now move on to our next panel. This is our panel with our providers. So to quickly introduce who I will be speaking with for this portion, we will have Dr. Onome, who is a neonatologist, Dr. Ikeke, who is also a neonatologist, Dr. Gloucester, who is a pediatrician and CEO of PCHS. And last and certainly not least, we have Ngozi Tibbs, who is a doula and founder of the Pittsburgh Black Breastfeeding Circle. Personally, thank you so much for that group and the information that you are sharing in that space for us. So we've got a few questions. We're going to kind of kick this off so everyone on the panel can kind of just give us a background on beginning with what is your philosophy, your mission and goals for pregnant moms and birthing people and their families.
Hi, thank you so much for having me in this space. And I'm just going to keep it brief. I think my ultimate goal is that we need to decrease our fetal and infant rates in our county. I think we all know that it's astronomically high in Black parents and Black moms and Black communities, and it's unacceptable. So we have to start thinking about innovative ways, which we're going to have further in our conversation on how to start looking at these, the causes and the sources of these high mortality rates and start tackling them, because like I said, it's unacceptable.
I can go next. So I would say, you know, I'm a neonatologist by training, but I also am a new mother and just had a baby like 16 months ago. So I think my perspective has changed greatly over the last like 2 years, just from having the experience. And I think my philosophy has also kind of shifted to kind of meet people where they are. And every family is going to be different. Every baby is going to be a little bit different. And so we come at issues from a medical perspective and a little more like black and white terms, and life is really a lot of gray. And so I think I've learned to really kind of hear people out and meet people where they are, and to really take into account how complex life is, and it's truly is never really black and white, and there's always a lot of other factors that are at play. And so how we can best assist our mothers, our fathers, our babies to be healthy as they can be, I think that is all of our goals.
I'll say for me, working in the maternal child health space for a number of years, it looks different for me now. When I started, I was a young mom. I'm now a grandmother, or more affectionately called Grand-Gazi, and things look very different for me now than they did even then. But one thing is still true. That was true for me in 1993 when I had my first son, as it is today in 2022. And that is, we need to talk to parents about what their needs are. What is important to them? What providers are making a difference? What helps those providers stand out? We need to also give space for families to talk about when they've had experiences that weren't positive, what made the difference. So yes, I want to hear more from families. So that's like asking a basketball player what is needed if they're a football player, right? No, if we want to hear what makes a difference in the lives of families, we need to talk to families. So I'm excited as a doula, as a grandmother, as a mother, and someone in this maternal child health space, of the importance of going straight to the folks, because that's where the answers lie.
I would say, and again, first of all, thank you for the opportunity to join this distinguished panel. That as a pediatrician who also has worked in the past as a consultant with Healthy Start, a consultant with maternal and child health for the Allegheny County Health Department, consultant with school districts, my passion is just been that those who are facing the the biggest barriers or having the worst outcomes deserve the best care and the best resources, not just some resources. And my passion has been to work tirelessly again to try to address that, because I think that our health systems and really sort of the way the sort of structure or infrastructure for health seems to work is that there is some efforts to get services into communities of the underserved, but there's no strong focus on the best services. There's no strong focus on increasing reimbursement, back to legislation and things like that, for Medicaid recipients to improve the care and to chip away at a lot of the issues that we have, because they're extremely complex. And as the other panelists have mentioned, our maternal and child, our infant mortality rate, again, in this county is atrocious. And I think it's going to take a lot of efforts with combining and really leveraging our efforts together to address it.
Thank you all so much. And I think as the chat is showing, we are just all personally thankful to know that we have folks like you who are working with our families, because it's so important that we have people who care and know that, the Black community also deserves the best when it comes to the care that we're receiving. I'm expecting, and I'm literally holding my belly as you all are talking, because it's warming. So I have my first question, which will be for you, Dr. Gloucester. So as the CEO of Primary Care Health Services, can you talk about from your experience how legislative action has impacted your practice and the patients that you work with? So for example, the Affordable Care Act was passed and it changed the way that we provide healthcare in this country. So.
Sure thing. Yes. So first, to give a little bit of background information to those who don't know, at Primary Care Health Services, we are a federally qualified health center, the largest one in Allegheny County. We have about 9 community health center sites throughout the county. And we function, all federally qualified health centers function in areas of health profession shortage areas or the underserved. Having said that, federally qualified health centers receive funding to support their efforts, but we're not fully funded federal programs. We're basically medical practices that are placed in areas of the underserved, and we receive some federal support for our efforts, and then we're expected to make up for those other losses, if you will, through the reimbursement for services. And we also have a mission that all of us, and a mandate that all of us have to follow, that we see everyone without regard to their ability to pay. So we see uninsured, insured, Medicaid, Medicare. Most of us are seeing, about 70% of our patients are Medicaid and Medicare, or public insurance, if you will, and then a small percentage of private insurance. And then we see a percentage of patients without any insurance at all. And so with that backdrop, how has legislation affected us? Well, again, the Affordable Care Act you've mentioned, I think that provided additional health insurance to those who were uninsured. And again, we put everyone that comes in on a sliding fee schedule. We're required by the government to do that it will determine what you're expected to pay for your visit if you don't have insurance, but then we don't turn you away if you don't have any money. So that Affordable Care Act was something that I think was helpful in some ways, in that it provided insurance to some who were uninsured. I think more recently, the things that we've looked at that have had an impact are reimbursement for telehealth. So during the pandemic, legislation was successfully passed, at least on an emergency basis, to allow us to receive some reimbursement for telehealth services, both mental health, which are extremely again needed right now, as well as our regular medical services. This has allowed us to improve access, decrease no-show rates because of that improved access, and provide care to these most vulnerable members of our communities. And we're in a bit of a legislative fight, if you will, or lobbying right now to continue these services. And there's a lot of support. Having said that, what FQHCs are fighting very strongly for are that we've been able to receive reimbursement for both audio only, meaning you have some of our families, elderly or what have you, they don't have a smartphone, they don't have a computer, but yet we're able to do a limited service visit just over the telephone and get some reimbursement for that. It's at a decreased rate, or to do it a full telehealth visit, if you will, with audio and video, and that is an increased rate. So that's been, again, very impactful on our services. And we're constantly looking at additional legislation around long-term funding, because FQHCs are funding it's sort of year to year, and also with us not receiving an increase in funding for about 7 years, but with costs increasing 20% or more over that time period. Again, we're continuously expected to do more with less, if you will. So those are some of the main issues that I think are in front of us and that have been impactful regarding legislation.
Thank you so much, Dr. Gloucester. I think it's having that first panel and then hearing that perspective is also really helpful to kind of just tie together some of the things that you're facing. And when you get into the actual practice of an office, how that policy and legislation is impacting the way that you and the folks that work with you can operate. So I appreciate that. Our next question, as we talked about earlier, the Build Back Better Act and how it could make the largest investments in American history to save moms' lives and end racial and ethnic maternal health disparities, advance birth equity across the United States, because it includes every eligible provision of the Black Maternal Health Omnibus Act, which when you hear that, it's like, why are we not doing this? But this question is for Dr. EKK. Can you talk about how you see the Build Back Better Act impacting the communities and families that you work with?
Thank you. Yeah, I think this will be huge for the families that I've worked with and the community at large. I mean, I think when you think about it, young people and young women, really pregnancy is the time that we are really connected to the medical system the closest. You have multiple prenatal visits, you have ultrasound, you have blood tests, and then in the postpartum period, it kind of drops off. And you have maybe that one postpartum visit, and that's about it. And your pediatrician may ask you how your mental health is doing, but there's all these other things to discuss also at the pediatrician visit when you're talking about how the baby's growing and things like that. And so I think being able to really extend those postpartum services to focus on the mother's health, which is very, very important, and really get thorough assessments of her mental health. Does she need breastfeeding support? We know that there's disparities in Black breastfeeding rates, and the success of that is really built on those the initial establishment of milk supply and feeling that support early on, because if it doesn't work in the first couple weeks, a couple months, your supply is going to dry up and that you're just not going to breastfeed. And, talking about getting them linked up with their specialists to kind of manage their chronic conditions. We know most of our chronic conditions will either exacerbate during pregnancy or immediately after pregnancy with all the hormone fluctuations. So there's so many physiologic changes that are happening with this mom in this postpartum period that this would be amazing for mothers to really feel like they are able to take care of themselves while they're taking care of another life.
Yes, and Dr. Oname, I believe that you had something that you wanted to add to this too.
Yeah, so I was also going to use this opportunity to also introduce one of the initiatives we are actually doing right now in the county, which is a collaboration between Healthy Start and the Allegheny County Health Department and our healthcare systems in Allegheny County to set up a fetal infant mortality review program. And I think as Representative Cephas has talked about, like getting those data and seeing how the changes we're making in our families how it impacts our outcomes. So I think for those of us who don't know, so we in most counties in the state, we have a fetal infant mortality review program, and this program actually tries to look at all the neonatal and fetal deaths in the county and try to see what could have led to these deaths, and hopefully with getting more information, try to improve community resources and service delivery systems. So generally, what we can tend to look at the deaths and examine the social, economic, cultural, safety, and health system factors that are associated with them, with the hope that after reviewing this, after getting this information, we can make recommendations that we can take to policy levels to try and improve the health and well-being of women, infants, and families. So I'm hoping that as part of the Build Back Better Act, we could and get fundings and get resources to initiative that tries to combat health disparity, racial disparity that have affected our health outcomes.
Yes, thank you so much for sharing that. I think that's really important, and shameless plug for Healthy Start. We did just recently have our infant health mortality town hall. So for those of you who are watching, definitely check that out on our Facebook page. So you can take a look at some really good presentations that we had regarding that, because yeah, the numbers are not good. And so we know there's a lot of work to do on that. So thank you, Dr. Onome. My next question, this is for Ngozi. So we're going to get back into talking about our doulas and the support that we know has proven to improve birth outcomes for Black mothers and babies. So from your perspective and experience, what do you think Pittsburgh can do to better support our doulas?
Thank you for that question. First of all, it's important that we know that the idea of doula is not a new concept. You know, the word comes from the Greek that means mother's servant or mother's helper. But if you know anything about our history as African people, when you look at some of the drawings, if you have some of the griots in the community share with you what things were like 100, 200 years ago. We have friends from Kenya that actually are telling stories that are 1,000 years old, right? They've been passed down, that when birthing people had babies, they were attended by other women in the community. They were mothers, they were grandmothers, they were aunties. So doulas, it's not a new concept. So important that Black people understand that, right? This is not just for white hippie folks that are vegan, right? But that doulas are for everyone, right? Because women deserve to have that support. So here in Pittsburgh, I think as we are talking more about doulas, we need doulas at the table when we're having discussions about maternal child health. So like we're doing here in this space, as we're talking about policy, we need doulas at the table. Doulas don't replace the provider. Doulas don't replace the partner, but doulas work with the family to improve birth outcomes. But we also need to understand that doulas are important for the postpartum period as well. Doulas can provide screening for postpartum depression. Doulas can also provide screening for postpartum hemorrhage, which we know is largely responsible for the maternal deaths that occur after childbirth. So doulas are an important part of this discussion, and we need to be here. So thank you for asking me to be here. So any organization that is concerned about maternal child health in the city of Pittsburgh needs to link up with doulas so that we can have these conversations and improve the birth and postpartum outcomes for families. But doulas aren't just important for the birth and the immediate postpartum, but doulas also provide the education and support for families, and especially in those early months after delivery, when those well child visits are so important, right? So Dr. Akeke talked about how, in the postpartum period, a lot of the maternal visits go down. And that's also true for many families. If they don't have a trusted pediatric provider, many of them are not going to their well child visits. Well, we have research on our side that doulas make a difference even in the well child visits that our families are attending for their children. So doulas are pretty important. And we need to remember that when these discussions occur, doulas need to be present. So Pittsburgh has their work cut out for us. However, there are lots of doulas in the city. So we need Pittsburgh maternal child health folks to just find out who they are, link up with Healthy Start, find out where the doulas are so that we can be here, so we can all see that healthy family.
Thank you so much for that. I mean, it's a team effort, you know, bringing new life into this world is not easy for all parties involved. So thank you so much for that perspective and the work you do. So going back a little bit to the Build Back Better Act, which is included in that was permanent year-long postpartum Medicaid coverage. In Pennsylvania, we'll be implementing this year-long coverage beginning April 1st. So I have a question for Dr. Onome, and that is, what would you like your patients and clients to know about this change?
Thank you so much for that question. And I think thinking on how to respond to that question. So obviously, I think it's exciting that at least we now have that extension to at least 1 year, but hopefully it can go as long as 5 years. And I think we cannot emphasize the importance of I guess the new concept of fourth trimester care, where we are providing optimal postpartum care. And when I think about it, like when you think about the things that are required during the postpartum period, you think about like mom's recovery, parental recovery from childbirth, and thinking about like health complications that may have developed during pregnancy, or that could have presented or during pregnancy or during the postpartum period. Then also thinking about like chronic conditions that may have been exacerbated by the pregnancy, and just thinking also about mental health, even just thinking about like the stressful factors just in the community and in the world at large, and how that also impacts our mental health, and obviously family planning. I think one of the most important part of the extension of services, of critical services, is that coverage gap, where even parents who before pregnancy, they can actually get care and get some preconception and consultations with their physicians, where they can actually prepare their body optimally for care. But I think one of thinking about this whole process, if we, as our members from the community have given us based on their life, on their lived experiences, these when we think about these factors, like I just listed, most of this care can be gotten in the community. And I think I've always been an advocate for moving from hospital-based care to community-centered care models, because I think we provide a lot of care in the hospital, but I think the healthcare services that a patient requires, only a very few fraction of it occurs in the hospital setting, and a lot of it occurs in the community setting. And the question is, how can we reinvest in our community partners? And we've talked about our doula services, which I think is very important, because I've had first-hand experiences where we are expecting moms or parents to reach out to the hospital for the care they need, when they can actually get this care in the community. And the question is, how do we restructure our care provision so that most of the care required, like mental health services, family planning, even management of complications, and not every time does the patient need to be in the hospital. Like, how can we make sure that parents are getting their medication, they have access to food, they have access to housing, which affects the health of the person. So I think focusing on community care models will be one of the ways we can use this coverage to tackle the issues we have in the postpartum period. Now, I think also I just want to also use this opportunity to talk about, we talked about doula service. I think one of the groups of patients that is usually missed are moms who have babies in the NICU, which I deal with every day as part of my job. I think when a mom gets pregnant and has a baby, she's not planning for her baby to go to the NICU. She's not planning to have a premature baby. So I can imagine that additional stress that just having a baby admitted to the NICU causes for mom. And I can imagine what it does to her mental health. I can imagine how it disrupts her work environment and disrupts her family environment. And the question is, how do we support those subset of moms? And I think myself and Dr. Keke are looking at how we can start thinking about even introducing the concept of doulas into the NICU, where we have doulas who are supporting our postpartum moms who have babies in the NICU, because I think that that is also a group of population that is sometimes missed if they are not connected to the system. And my hope is that we can get every mom who has a baby in the NICU at least a doula to help them navigate what it means having a baby in the NICU, how we can support them better, and how we can actually take care of the needs that they need during that interval. Thank you.
Thank you so much. And I know Ngozi put in the chat, I know she really appreciated that perspective, especially, you know, when we're talking about our medical professionals. You know, everyone doesn't feel like they are supportive of a mom or a birthing person wanting to have a doula there. So that's appreciated. My next question is for Dr. Ikeke. This one is, what practices and policies can change in hospitals and birthing facilities to create better communication and care from providers to their patients?
Thank you for that question. So, you know, I thought a lot about this question, and I think it's really hard because I think, like Ngozi said, we need to talk to the families about what they need from us. And I think there is often a disconnect between the medical providers and the families, where we think we're communicating to the best of our ability and the family is not receiving that for various reasons. And so I think when we talk to our families, some of the feedback that we have gotten is that, you know, they feel talked at and they weren't really involved in the decision-making process. So I think as a system, we need to try to incorporate, we need to respect the medical expertise we have, right? Because we've went through years of training and things like that. And so we do have some medical expertise in the field, but there is a conversation that can be had, and there is a middle ground, and there is a shared decision-making process that should happen in these situations. Because like I said before, a lot of these situations are not black and white, and there are a lot of gray, and there's mitigating circumstances that a family is considering on why a plan may or may not work for them. And I think, you know, if we can incorporate, you know, like having nurses giving their medical sign out, or the doctors giving medical sign out in the room with the family so they can participate in the discussion about the birth plan and the labor plan. I think when you're pregnant, you often fill out your paper birth plan and you can carry it with you, but there isn't a lot of like, let's review before everything gets started on what all the things that you are expecting. And, oh, we need to change course now. A lot of these things happen on the drop of a dime, but I think families often feel that things are happening to them and they're not really feeling like they're included in any of this decision making. And so I think having that conversation between providers and families where we have a mutual respect of, you know, I know some things, you know some things about your body, and you know, can we come up with the best plan to get a healthy, safe baby here?
Thank you so much for that. Yeah, I'm just really appreciative of all of your feedback and perspectives to these questions. So this next one is for Ngozi. And I know this one was really big with especially our Community Action Network. And as we're planning this event, when we're talking about moms and babies, but also talking about the dads or partners in a family as a whole throughout the birthing and post care of mom and the birthing person and the baby. So can you just talk about what policies are in place or not in place that is supportive for the whole family?
Very good question. You know, so often dads and partners are not at the table when conversations are had about their families, which we need to stop that immediately, right? Because if we support that healthy mom, that birthing person, and then she has a partner and they have this baby, right? That helps to support that healthy family. Healthy families make up a healthy community. and healthy communities make up a healthy society. So we cannot leave the partners out of the discussion. We also need paid paternity leave, right? We need paid maternity leave and we need paid paternity leave. So I'm so happy that one of my recent clients, her provider, her insurance provider, or her partner's insurance provider, has him on 12 weeks of paid maternity leave. Now, is that possibly because they just had twins? I think that's possible, but that's going to make a world of difference to the health of that family who did have their babies in the NICU. They are now home. We are very grateful for that, but they also have an older child. So as I'm thinking about that particular family, having that father be present and be supported by the doula is going to make a difference. So as we talk about that, we need more policies in place that provide that paid paternity leave. And again, going back to what we just talked about, we need to ask the fathers what they need. What do they need to feel supported? We have to remember that they made this baby together, so she's not on her own. So we need to also have, talk to him. But, an area that we have not done enough conversation about is postpartum depression in partners, right? So the conversations are increasing as we talk about postpartum depression in mothers, but we also need to talk about postpartum depression in fathers. And we have to remember that right now, people are trying to parent and raise babies in a pandemic. So yeah, we have to keep that in mind. And, I'm happy to say that organizations like Healthy Start are making a difference. Organizations like ROBE, which stands for Reaching Our Brothers Everywhere, they're having these conversations, asking dads what do they need from other dads and partners. But we can't forget the female partners as well, which is an area of focus of mine recently. As I'm working with more non-binary couples, they're asking those questions too. What can my non-binary partner do to support me as well? So I think the conversations are started, but we can't stop there because sometimes we get stuck with just talking and we get busy just having conversations. No, we need conversation, action, and policy changes.
Thank you so much for that perspective, Ngozi. I think it's super important that we do begin to discuss more how more broad this conversation has to be when we're talking about our families. So I'm going to wrap this up and have a few more questions, and it's open for all of our panelists. But basically, we know that there are biases in healthcare on all levels, and the pandemic has exacerbated the biases and also capacity in healthcare. So in what ways have you in your current role prioritized addressing biases within healthcare affecting moms and birthing people? And I want to give this to Dr. Gloucester first.
And thank you for the question. I think it's an excellent one. I think that we are unique in our sort of mission in that FQHCs have to have at least 51% or the majority of their board has to be patients. Secondly, I have a personal focus and intentional sort of strategy around our providers, our medical providers, our support staff, our leadership. For me, it should reflect the communities that we're serving. There have been a lot of studies to show that outcomes improve when your medical providers and provider staff look like you. And I think that's related to not only having individuals that know what they're talking about, as Dr. KK had mentioned, not only caring, but as we've also talked about, rising to a level of understanding. And so when those three things exist, I believe that's when we get the best outcomes. And so within our organization, that's our focus, that we have a diverse provider staff that reflects the community, diverse leadership that also reflects the community. And I think on top of that, we have also engaged in not only training around anti-bias, but anti-racism training even amongst our staff. And I think it's, some of my leadership staff have talked about how it, even as, say, an African-American medical director, my medical director has said, this training has helped her understand herself, that she, these things exist within her as well, so that we all carry these things. And so I think that organizations really need to look at that kind of focus, and that has to be a priority. It can't just be something else that we have to do. Like our priorities in many organizations are, many more things, the bottom line, getting other accolades, and then, and then we also have to do, either this training, or we have to look at these things. It's looked at something that you tag on at the end instead of priority.
Thank you so much. Any of our other panelists have anything you want to add to that?
Sure. I think personally, one of the methods I've used is what we call the ICE method, where if we see something, hear something, we stop, interrupt the person, inquire about what they're talking about, then correct them if they need, and then educate them better. So I think I've been trying to use that principle every time in my work, in the workplace. I hear something that is not right, and then I try to put that into practice over and over again. Then I agree with Dr. Gloucester. I think thinking about how we can increase diversity and equity in our workplace. And I think not just only focusing on one group of people. So like, for example, not just focusing on healthcare, not only focusing on healthcare physicians or only on the nurses, but I think across the spectrum. So thinking about from the doctors, the nurses, the support staff, including the respiratory therapists, the lab technicians, the nursing practitioners, physician assistants, our doulas, just expanding the whole network, and not just only getting them recruited, but also how we can support them and support their project, and not just having them as like the post office of the department of the institution, but how do we provide ways we can mentor them, and how we can also provide ways that we can support them to make sure that they are successful in whatever projects or things that they engage in.
Thank you so much for that. So I have two more questions, and this next one, I'm going to give this one to Dr. EKK, because I feel like you really kind of touched on this throughout a lot of your responses today. But when we talk about the changes that we want to see, when we talk about healthcare that's provided, you really dug into a more patient-centered care model. So can you just talk a little bit more about how you see those kind of changes happening on in a more systemic way throughout healthcare, and not just for you as an individual as you practice?
Sure. That's kind of a big question, but I think, it requires us to come with a little bit of humility, right? And that we know some things and we don't know everything. And I think that is an important distinction in a conversation to have with families, because I think incorporating them as much as possible I think sometimes physicians feel like they need to come with their authoritative opinion to appear competent, if that makes sense. And so you don't want to sit there and postulate and be like, well, I don't really know, but we could try this or we could try that, because then it sometimes breaks trust, and maybe they think you don't know what you're doing. But really, I think what I've learned is, and there's actually studies that have borne this out in the literature, is that families really appreciate that that mental thought process of how you came to your decision. And so as much as we can include them into the conversations early on, whether that is coming up with the birth plan, reviewing the birth plan on admission during labor, and kind of reassessing the goals with each twist and turn throughout the labor. And then after the baby is born, we as the physicians in the NICU and the pediatricians, we're also going to go over expectations. This is how we expect it to go. But when things don't go how we expect it to go, we need to regroup. And we've done some initiatives in the hospital as far as what we call like huddles. And it includes family members. We have like parent conferences that we can schedule on a weekly or bi-weekly basis in the NICU or on whatever service it can be on, where the family comes in or they join by phone virtually. And you'll have all the specialists that are involved in the baby's care. You'll have your physician, you'll have your nurse practitioner, your bedside nurse for that day. And we all talk about, okay, these are the day-to-day things that we're dealing with, but also what is our long-term goal here and what's our big picture plan? Our big picture plan is we want this baby to go home. How do we make that happen? Or the family says, I really don't feel like we're making any progress at all. Can we try X, Y, and Z? Well, what do you think, specialists? Do you think we can try X, Y, and Z? Yes, we can try that. Or no, we can't try that because of this. And I think that has been the most effective way to bring everyone together in the same room and to really establish a plan of care that people are comfortable with. Because sometimes medicine becomes a game of telephone because, you know, mom has to go back to work, right? Or dad has to go back to work, and family oftentimes can't sit at the bedside all day. And so what ways that can we come up with? And with the invention of telehealth and all these virtual platforms, we have a little bit more flexibility to really include the families in real time on medical decisions and not make a decision and relay it to them and go back and forth about whether we all agree or not.
Thank you so much for that. This panel was amazing. Today was amazing. Dr. Onome, Dr. Ikeke, Dr. Gloucester, and Gazi, we thank you so much for your information, your expertise, your work, and this panel was just amazing. So I'm going to pass it off so we can wrap up this morning's breakfast, and I will send it over to Alicia and Jada.
Hi, everyone. Thank you for joining. My name is Alicia Davis. I'm here representing the March of Dimes Western Pennsylvania market. And we've heard a lot today about being an activist, being an advocate, getting involved. And so really briefly, I'm going to share with you all some practical ways that you can get involved through the March of Dimes. And our mission aligns right with Healthy Start. And so if you could please put my slides on the screen and we'll go through them super quick. All right, next slide, please. So just as a FYI, every November, the March of Dimes publishes a report that gives every single grade a state based on their preterm birth rates. Pennsylvania received the C+, and we know, I don't want to preach to the choir, that when we look at the disparities in the rates, we know that Black women and Alaska Native Indigenous experience the highest burden of prematurity, infant mortality, as well as maternal mortality. Next slide, please. Because I want to get to the exciting stuff, which is how you can get involved. So again, this is just reiterating the disparities in the data that we see, and all this is available on our website. I'll be sure to put all those links in the chat. You can go to the next slide, please. And a lot of policies were discussed today, and I wanted to show you all this brief one-pager that kind of synthesizes everything that was discussed. So as you can see, these are the policies that are currently being talked about in Pennsylvania, and our progress. You can see the ones that we don't yet have legislation for, that we are working on, and ones that we have gotten passed. Next slide, please. All right, so how you can get involved. Next slide. There are multiple opportunities to advocate alongside the March of Dimes. First, you can join our Advocacy Action Network. It is really simple. All you have to do is put in your name, your address, and a telephone number and an email address. And what will happen is every so often, every time there is new federal legislation, whether there or something specific to Pennsylvania, you'll receive either a text or an email asking you if you want to email your legislator. And it is really just a click of the button. You don't have to write out the email. We already have it drafted for you. You put in your information and it gets sent to the legislator in your area. So that's one way you can be involved. Another way you can be involved is this May, we're going to have a lobby day, a virtual Pennsylvania Day for Change, March for Change, where we will be having a kickoff event. We will also be having multiple meetings throughout the day with just different legislators, asking them to support the bills that matter to us. All the things that everyone talked about, doula legislation, paid family leave, environmental health, and lead, and the impact of lead, not just on babies, but also on families. And so I am asking and inviting you all to join us. You can be involved by either attending the meetings, and there will be a training. It's a whole thing. So don't be afraid, and make sure you go register so you can learn more. But we'll have an opportunity for you to either attend meetings and talk to legislators, or you'll be able to, at the convenience of your home, by a click of a button, send out emails, so we can do a huge blitz in the state of Pennsylvania and really energizing and activating our policymakers to hear our concerns and to know that there are people out there that we have the solution in community. And so I really encourage all of you to participate. I will put the links to the Advocacy Action Network in the chat, as well as an opportunity for you all to register if you want to participate on Lobby Day. And there will definitely be more information to come. Thank you all for this time to share. And if you have any questions, next slide. Here is my contact information at the March of Dimes, and I look forward to hopefully partnering with a lot of you in the months to come, because this is just the kickoff. We have a lot of work to do, as you've heard, and so I'm ready. So I hope you will join me. Thank you.
Thanks, Alicia. I'm not sure if on your last slide, your email address was cut off. So if anybody needs to contact Alicia, if you can put it in the chat, please. So again, thank you so much. We have actually, our CAN has participated in those days of action, and it is very easy. It's a very easy way to raise your voice around those issues that March of Dimes is helping us to navigate in our legislative arenas. I am really, really full from today's fabulous session. Thank you so much again to our Community Action Network, to all of our speakers, to our Healthy Start family who is watching from a distance, and to our staff, our board members, everyone who contributed to today. I think if there's anything that's undeniable, it's the amount of energy, expertise, and passion that we have in Allegheny County to deal with this issue and to make things better. Oftentimes I hear time and time again, kind of, we're still where we were 30 years ago or decades ago. And while I believe that we still have a long way to go, we are absolutely fighting an uphill battle. Dr. Larkins-Pettigrew said this morning, the political determinants of health. So we talk about the social determinants of health, but we also talked a lot today about our political landscape and how things have changed. We heard testimonials. We heard about systems of care. We know that families are dealing with increasingly complex circumstances around their physical health, mental health, the environments where they live. So we are facing an uphill battle, but I believe that there has been progress. I believe that there will continue to be progress. I know within our Healthy Start system, we are seeing tremendous progress with the array of services that we provide, with our ability to work more effectively in community, and with our ability to work more effectively across systems. So I want to leave us on a note of hopefulness and a note of continued action. Another way that folks who are watching can continue to support this work and learn more about it is by joining our Community Action Network. So India, if you can put in the chat your contact information. If you have interest in learning more about our Community Action Network, please reach out to India Hunter. She was the primary person on our staff facilitating today's event. So thank you, India. Kudos to you for pulling this together. Sherelle, Latavia, everyone, thank you so much. This is an example of the call to action and the kind of work that our Community Action does that creates an impact. They are our voice on the ground in a number of different ways, representing different sectors, because this is a cross-sectoral issue. This is not only about baby showers and home visiting. This is about how do we create a community and an environment that is conducive to life and conducive to sustaining health. So again, thank you so much for coming and joining us today. We will definitely continue the conversation. We can't do this work without you. So everyone, have a great rest of your day. Please continue in dialogue with us on our social media. Feel free to reach out to any of our Community Action members or myself or any of our staff, and we will continue to work with you on addressing this issue. Thank you.